Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
This is very, very important. We read so much about the Zika virus. We don't read much about hyperbaric oxygen. We have had many shows on this years ago, and I'm so glad to bring back an expert, Dr. MICHELE Reillo, who is from the Neubauer Hyperbaric Neurologic Center. And Dr. Reillo, thank you, and we're so happy for you to be able to talk to us about this terrible disease. I guess it's not a disease, it's the Zika virus, and what everyone's doing about it.
Thank you, and thank you very much for inviting me. As we know, the Zika epidemic in this country and worldwide has gotten a great deal of attention. We've focused on the microcephaly in infants, but very little has been directed to what happens to the adult brain if you happen to acquire Zika. Zika is a mosquito-borne virus, and in Florida, South America, actually worldwide now, we see an epidemic of mosquitoes that are carrying Zika. Unfortunately, Zika often presents with very little symptoms, and some people, they acquire a rash or flu-like syndrome. However, afterward, people often develop severe fatigue, cognitive problems, low vision. It's a percentage of individuals who develop a chronic debilitating disease after they have acquired Zika infection. While the majority of people do not develop such symptoms, there's a significant population of individuals that we are discovering that have this type of syndrome.
So, Dr. Reillo, I remember when it first came on, we were worried about pregnant women. It wasn't something
Correct.
that we even thought that adults would have a problem with. Isn't that true?
That is correct. And frequently, we see isolated incidences where people develop neurologic conditions like Guillain-Barré, which is a very severe progressive neurologic condition related to Zika. But more subtleties that are occurring in the adult brain can be managed with hyperbaric oxygen therapy. And we are very blessed to have the Neubauer Hyperbaric Neurologic Center in Fort Lauderdale that was recently acquired by a large progressive medical company called Alternate Health, and we're very excited about that. We recently conducted a research trial looking at post-acute infection in adults who had acquired Zika. And the reason we did this really is based upon work that Dr. Neubauer did many years ago, and I was very fortunate to be taught by Dr. Neubauer and his colleagues many years ago when we were looking at HIV. And HIV also attacks the brain, as does hepatitis, as do a lot of infectious diseases. And they cause progressive neurologic complications, and the patient feels very, very debilitated. They have what I term foggy thinking, low vision, difficulty retrieving words. And we began seeing this type of phenomenon with Zika. We're also seeing with dengue and chikungunya, which are also transmitted by the same types of mosquitoes that transmit Zika.
So now
we ran a trial.
My question is then, so since so many other things are not working, how did people come up with hyperbaric oxygen to be an answer?
Well, again, the wonder of hyperbaric oxygen therapy at low pressures is that it permeates the brain, crosses the blood-brain barrier, and it does a couple things. One, it reduces the inflammatory process, which is associated with Zika or various other infectious diseases, and we've known that for decades. So the inflammation that occurs when you get a virus or a bacteria or diseases that may be autoimmune, they all cause inflammatory processes. And those inflammatory processes cause you to feel very fatigued, lose concentration. It may affect your vision, your ability to speak or understand language. And it's very similar to what happens to patients with Lyme disease. They people with Lyme disease often get the type of brain disorder I'm describing, and it lasts for years and years and years. And indeed, we do use adjunctive hyperbaric, meaning with combination with medications, in managing those diseases. Now, with Zika, we don't have anything. It's all supportive care and wait and see. And so a lot of times people get over the initial infection but are left feeling absolutely horrific. So we ran this trial, and lo and behold, we ran 10 subjects, and they all responded within 2 to 4 treatments, and they went completely 180 degrees. And we're just delighted, and obviously so are the patients, because some of these people had acquired Zika 2 and 3 years ago.
Yes, well,
and so it was very exciting for them to go back to how they used to feel.
Amazing. So I don't know if I don't remember reading this. Can a Zika attack another mosquito and give it to a mosquito also? Is that how it works, or how does that work?
Well, mosquitoes innately carry, when they breed, the Zika virus is transmitted in the larva. And again, then the Zika virus is transmitted from person to person via mosquito bites. It's also a sexually transmitted disease. So it has that commonality, for example, with HIV. And it's very important that we understand that you may be asymptomatic, meaning you don't have any symptoms at all of Zika, but if someone you have been intimate with has Zika, you can easily acquire that virus. And that is a major concern when we're looking at pandemics such as Zika.
All right, so what has really happened in the United States with the Zika virus? At first, it was pandemonium in the way. They were just doing lots of things. Are they still very intense on this? Because I don't hear much about it.
Yes, as a matter of fact, in the news just a couple days ago, the mosquito population has been found in Miami-Dade to also have an increased number of mosquitoes that are carrying Zika. We're seeing it again spread through in California, Texas, up through the Midwest, South America, the islands, Asia. I think the lack of attention is because it's now as opposed to being an acute epidemic, it becomes a chronic problematic epidemic. But the warnings are still there. And it's very, very important that people take the precautions to prevent mosquito bites if they possibly can. And indeed, if you get Zika, if you acquire a rash, fever, flu-like symptoms, that you immediately get checked for Zika, or you have been in contact with someone who perhaps has Zika. And that's very important that you get tested.
Well,
for people who have had Zika, yeah.
Right. Well, what I want to do is for people who are listening and saying, well, what do? I want to give some information out. My guest is Dr. Michele Reillo, Reillo, and she is with the Neubauer Hyperbaric Neurologic Center. They're located at 4001 North Ocean Drive in Fort Lauderdale. It's Lauderdale-By-The-Sea. And I'm going to give you a phone number. Remember, this is Pencil Talk Radio. I always tell our listeners to get your pencil and your paper out. You may not have a problem today, but maybe you will tomorrow, or you'll have a friend or someone that you can help. The phone number to call them is 954-771-4500. 4,000, excuse me. Let's do that again. Cross that out on your paper. It's 954-771-4000. Great number. And let you get to their website, which is Ocean HBO, oceanhbo.com. Okay, so why don't you continue? So now you have this clinical study going on. Will you be doing a lot more of them?
Yeah, we intend to expand it to a second study, but for those who have symptoms of fatigue and neurologic issues and foggy thinking, they don't have to wait for a study. The Hyperbaric Center is there to provide treatment. And for those who are familiar with hyperbaric, it's a very simple process of breathing oxygen in a contained device that is very, very comfortable, and you can watch television and what we are seeing with these types of infections that are attacking the brain is that the oxygen permeates the brain, reducing the cells that are inflamed. Their response is what's causing the process of foggy thinking and difficulty with movement and severe fatigue. Once that inflammation goes away, then once again, you return back to a functional state. And that's very, very important. And for people who've had dengue, for example, that also causes anemia. We had a couple patients who had dengue as well as Zika. The hyperbaric will assist in reversing the low red blood cell count, the anemia. Again, very, very important. As if you've traveled to South America, for example, you might be at high risk for dengue as well.
So my other question is, have you met any women who are pregnant, and what are they doing? They're waiting to have the child before they then get to use the hyperbaric oxygen?
We're not presently treating women who are pregnant at this time. That may be a study in the future that we would like to do. We're only focused on adults who have had Zika who are not pregnant, and because there are a lot of clinical issues that we need to address with pregnancy. However, women who are at risk for developing Zika, who may want to get pregnant, or are young women who have acquired Zika, that's something that we need to address, because there's a significant risk to transmitting that to an unborn child. So again, the issue is prevention. If you do acquire Zika, is again to seek treatment and to seek testing, even if you feel fine. It's critical, and there's a latency, a waiting period before you will want to become pregnant, and that also goes for men. With men, the issue is that the Zika virus still remains in your system, and you can still transmit that. So regardless whether you're male or female of any age, but of childbearing years where you may want to have children, we need to address whether or not you are at risk for Zika and you have acquired it. That's something that you don't want to transmit to an unborn child.
Well, Dr. Reillo, that's great advice, and I hope people, if you're listening, you're a grandparent, talk to your adult children. If you know they want to get pregnant, it's very good advice. The other part of this, though, is that when I was dealing with Dr. Neubauer many years ago, he also felt that people with strokes and any other kind of neurological problem needs to go into hyperbaric oxygen. And yet, all these years, we only see a few hospitals that have done this. What seems to be the problem? To me, there's been such good results. I mean, I've known all the results that Dr. Neubauer talked about. What do you think is wrong with this?
Well, the traumatic brain injury and the chronic traumatic encephalopathy, for example, that we're seeing in athletes, all responds, post-stroke, all responds to hyperbaric oxygen therapy. And yes, the irony is all these years later, Dr. Neubauer's great work has now come 180 degrees, and indeed all these athletes are going into hyperbaric chambers, and at the Neubauer Center we will be running trials on post-traumatic stress disorder and on chronic traumatic encephalopathy in the next few months. And again, Alternate Health is, again, very, very progressive and supportive in this pioneering work and renewing his work. The issue for reimbursement seems to be problematic, and that really has been what has governed how the hyperbaric treatments are reimbursed by insurance company. The key is always money. It's not lack of research. I've been doing this for over 30 years, and I was trained by Dr. Neubauer, and so it's wonderful that we're now seeing people finally embrace it. The key is convincing the insurers, and many of them are coming around, especially for the military. We're very excited about that.
Yeah, that's wonderful to hear that.
Yeah, it is very encouraging, but it's not fast enough. We'd like to see that door wide open, but it is opening, and we can challenge those situations on cases even with insurers that would never even contemplate paying for it. So we're very encouraged by the research, and now it's a pretty standard of care for post-concussion syndrome, for example. That's very, very critical for our young athletes.
Good for you. I hadn't realized that. So that's excellent. But now, since they have been struggling with what to do with the Zika virus, maybe this is the key.
Certainly is part of it to address the neurologic and the eye problems that occur with Zika. Certainly, hyperbaric is part of the picture as we go down the path of either developing a vaccine to prevent it or using antiviral therapies that maybe we've used in the past. But again, as you know, we go down this road, we're 2-3 years out, perhaps, of developing a vaccine or drugs to treat this. But right now, if you have neurologic issues, if you've had Zika, if you've had post-concussion, the availability is right now. You don't have to wait.
Yeah.
Hyperbaric is available to you, and it's amazing. I mean, it's not magic. It's simple, common sense. Oxygen is a drug. It's administered by a physician at the center. The key point here is that we've known for years, Dr. Neubauer talked about how oxygen crosses the brain. Can you think of any other way to reoxygenate your brain other than hyperbaric oxygen therapy?
No,
there isn't any.
And he would say, before you go for a test, if you're going to get into college, go have a session at a hyperbaric oxygen chamber, and you'll do much better, right?
No, that's correct. That is correct, because, reducing the inflammation in your brain and the blood circulation that occurs, we have gotten used to breathing very low levels of oxygen in our atmosphere. Once you walk out of a hyperbaric chamber, you realize how things are to appear, how clear colors are, how energetic you feel, how clear your eyesight is.
With just one
treatment
session? No kidding.
No kidding. That's absolutely true. Even in the healthy adult, you will even notice those. It is absolutely amazing. And so you can imagine the benefit for people who struggle every day, for example, with the side effects of Lyme disease, who have had a stroke, people who are suffering from chronic autoimmune diseases like lupus, multiple sclerosis. All of these diseases cause scarring and chronic damage to the brain. And if you eliminate that inflammatory process, then you're able to improve your quality of life. And that is the key here, is improving quality of life, reducing pain. And that's what we use hyperbaric for. It's not just for wound healing. The biggest contribution that Dr. Neubauer made worldwide is that this is used to save the brain. And there's a book on Amazon, not only Dr. Neubauer's work, but Dr. Philip James, he was one of Dr. Neubauer's colleagues. His book on hyperbaric oxygen therapy is also available. And I encourage people to read, because this,
what
again,
is the name?
Is not new.
What is the name of it?
I'm not sure. It's hyperbaric oxygen therapy. I believe it's the journey of our time.
Okay, but it's by Dr. Philip James, right?
James, yes. And Dr. James is from the United Kingdom. For years, worked with Dr. Neubauer and Dr. Neubauer's work on hyperbaric oxygen therapy, K.K. James' book on hyperbaric medicine. All of these are available on any online internet. If you cross-reference hyperbaric and Amazon, for example, or any of your booksellers, you'll see that my book on AIDS under pressure talks about AIDS and hyperbaric oxygen therapy. Again, that was our precursor to looking at it with Zika.
So you wrote,
we had used it with AIDS.
You wrote a book on AIDS? Is this what you did with your name?
Yes.
That's great.
Yes, it's called AIDS Under Pressure. It was published in the late 90s.
Wow, that's great.
Yeah.
I'll have
before we had antiretrovirals.
Oh, that's really superb. Now, it must be a dream for you to be able to come back and work where he really created this. This must be really special.
It is. It's very, very special for me, and Dr. Rodas and Dr. DeVicolis and all the staff at the Hyperbaric Center, Alea Rodas, they're wonderful, caring, compassionate people. Been around Dr. Neubauer for years.
Right, I remember.
So we are very, very fortunate that they're still here and that we can use our experience to help other people now that we're going forward. I know Dr. Neubauer is getting a charge out of watching all of this.
Absolutely, but I've had Dr. Rodas on my show also, and I have to say, I'm so interested now in meeting you. So sometime, will you be back? Are you just on vacation?
Yes.
Okay,
No,
you'll be back.
No, I live here.
Oh, you live there.
Definitely.
So when will you be down at the Hyperbaric, at Ocean Hyperbaric? Do I have to make an appointment to be able to meet you?
We just can arrange an appointment.
Okay. Well, maybe when you're there the next time for something, then I can schedule to be able to see you. I'd certainly like to meet you. Yeah,
Thank you.
Yeah, no, I'm very impressed, and I hope people who are listening will, you can go for a tour down there also. If you don't know much about hyperbaric oxygen, you can go there, you can see it. There's nothing to be afraid of. It's really quite a beautiful setting, and as Dr. Reillo said, that it's really nice. You can watch television while you're getting this. And what does it last, for about an hour? Is that how long it takes?
Yes.
Yeah, so
it goes very, very quickly. You're lying down watching television or taking a nap, or just enjoying the peace of not having to worry about a cell phone, a sound. It's your time.
Now
it's wonderful.
Yeah. Now you also, of course, have done wound care there, and I know that now that's one thing that has been accepted by the insurance companies, and so that's the weirdest thing that would be accepted, and yet the thing that's even more strategic, the brain, they haven't figured that one out yet, but it's going to come. I think that you're right. The fact that the military and the sports people know, because listen, if some guy gets hurt, they want him back doing what he does, right? He's a big asset, they'll pay anything to do it.
That's correct.
So that's
good. That is correct. And it is good. And chronic traumatic encephalopathy that happens after concussion, which I'm hoping we can talk about it at some point.
We will. We'll have another. Sure. We're going to have you on the radio again. Sure, we'll do that.
Well, thank you. We'll talk about people developing dementia from head injury. And, we know now a lot of the large athletes are using hyperbaric chronically, even as they're playing in the NFL and the NBA, because of head injury. And concussion starts a process that does not stop. And you get repetitively hit in the head, whether it's an automobile accident or fall, playing sports. Long term, it causes something called chronic traumatic encephalopathy, which leads to dementia.
Amazing.
And we know that.
Amazing. But the other thing we can't talk about today, but hopefully we will, is when especially an older adult has anesthesia. It just really takes them down. And so that's another thing that I've always felt, that if you have anesthesia after an operation, go have a few sessions in hyperbaric oxygen to get your brain revitalized.
I would agree with that, and I would agree that pre and post dental procedures, if you die, or before surgical procedure, if you go, we call it in lingo is diving, but if you go for a hyperbaric treatment prior to, let's say, a root canal, one is going to help you heal. Okay, we oxygenate that part of your mouth, and then after the process is done, you come back in and once again have treatments to help you heal, and the improvement is remarkable. So that you avoid rapid healing, you avoid long-term use of opioids and narcotics, and you're back to going about your life again.
I just saw something on the news, though, with children who were sedated in dentistry, and some of them, one died, and another is suffering terribly. Right. Have you seen that?
Yes, unfortunately, anesthesia doesn't necessarily agree with people who are very, very young or older adults. And I agree that being treated in a hyperbaric chamber post-anesthesia is very beneficial. I mean, it's absolutely critical to reoxygenate your brain.
Wow. And so it's post or before?
Both.
Before and after.
Before and after, whether it's a dental process or a procedure that, again, is befitting hyperbaric. Not all procedures are. But, for example, if you're having orthopedic surgery, having a knee replacement, a hip replacement, treated before and then after. That's something I did for years and years and years when I was in the Northeast. And especially for orthopedic replacement. I mean, it's horrible surgery, painful surgery. But people respond very nicely with hyperbaric because you're reducing the inflammation. And so with reduction in inflammation, then the pain dissipates. And you don't wind up taking narcotics for long, long periods of time.
Well, I know a plastic surgeon here in South Florida that has just a mini little oxygen machine, and he does this for his patients to help heal them.
That's wonderful.
So, I mean, some people are very smart, know how the value of the oxygen, but I think just getting back to when we started this whole show, the Zika virus is very serious, and we really appreciate your being on our show, and I look forward to meeting you and coming down there. And remember, everyone, let me just give that information one more time. Please go on their website, which is oceanhbo.com, where their phone number is 954-771-4000. Thank you so much, Dr. Reillo.
Thank you very much for having me.
Yeah, it was a pleasure. Bye.